These next three speakers are forging their way as entrepreneurs and local community leaders by designing and developing new paths. They are all 2019 Next 36 participants. To tell us more about that, we'll hear first from Luke Butterworth, an EMBA candidate at the University of Alberta, CEO of TrioovaCare, followed by Ravina Anand, a master's student at the University of British Columbia and COO of INLET Health, and her colleague, Bryce Thomsen, MD student at the U of A and CEO of INLET Health.
Thank you so much. So let's give our shameless plug to the Next 36. It's a program out of Toronto that's basically the foremost Canada's incubator. So what it was designed to do is to actually cross this prosperity gap between Canada and the US. So the creators looked at this program and said, how can we use it to actually develop the Googles, the Facebooks, and so our one claim to fame is not necessarily RIM. So over 9 months, they put together a group of individuals from all across Canada, these high growth entrepreneurs. They whittle us down over 4 days from 72 to 36, kind of just have at it between us. And at the end, we're enrolled in this 9-month program, which puts together funding, advisors, and mentorship in a very dense community within Toronto. So we actually go to the U of T for 4 months, starting in May, and that's where we are taking part in sessions that are all towards one thing, and that's creating a high growth company. So what I'm going to do is pass it off from myself to Ravina and Bryce to talk a little bit about how they think the Next 36 is actually going to advance them and basically bring some of that density, that high growth entrepreneurship back to Edmonton.
Hi everyone, I'm Ravina. I'm a born and raised Edmontonian, and last year Bryce and I came up with a health technology aimed at reducing the health barriers for minority populations. And through this program, we're very excited to meet with young innovators from all across Canada with very diverse backgrounds. As a part of Generation Z, we ultimately hope to gain skills in business entrepreneurship, meeting with investors, and really showcasing Edmonton talent.
Hi everyone, my name is Bryce. I'm a third-year medical student from the University of Alberta, and I'm also part of INLET Health with Ravina. So through medical education, I've had the opportunity of incorporating a lot of technology into our curriculum at the institution of the U of A. And with this, I think there's a huge importance for digital stewardship regarding the future of medicine and its combination with technology. So I hope to explore some of these ideas, such as AI and the data sets that we actually use to collect this information can have huge disparities on the minority populations that aren't represented in the coding and the algorithms of these technologies that are now being started to incorporated both into medical education and our hospitals. So this is one of the ideas we also hope to explore in Toronto, both to help with Ravina and I's company to reduce these outcomes faced by minorities, as well as bringing back ideas to the tech community in Edmonton.
So quickly, I'm just going to talk about how we're going to be using the Next 36. So Triova was basically focused on virtual care and how can we actually use this technology, primarily telehealth, to interact with patients at a distance so that you can close the gap in rural healthcare and remote care. And so we're actually using the Next 36 program to specifically focus on virtual home care management and utilizing telehealth to be a big part of how we can actually have healthcare or home care managers and HCAs and in-home staff and smart devices picking up data so we can act proactively and preventatively as Reg suggested. This is really where health is moving. This is the transition is preventative medicine. So identifying things in home, opportunities for intervention, and that's how we're going to use the Next 36 to basically point our company in one direction, use the density and the tech density that's in Toronto, along with the funding and this Next 36 program to elevate our business and bring that back to Edmonton so that we can really tap into Health City and be a crucial part of this ecosystem. Yeah, and that's everything for us. So thank you very much. Yeah.